All right, let's jump right in. Today, we're going to open up a playbook that could completely change how your dental practice runs. We're talking about mastering AI to handle all that clinical documentation. The single biggest time suck. So you can spend less time on paperwork and more time, well, with your patients. So let's start with just one number, but it's a huge one, 90%. What does this number even mean? Well, it pretty much defines the frustrating reality for almost every single dentist out there.
That's right. A staggering 90% of your documentation time is eaten up by just 6 core tasks that you do over and over and over again. Now, this isn't about all your paperwork. It's about a very specific, high-volume bottleneck that's slowing you down.
So here's the big question we're tackling today. What if you could just take all those hours back? What if you could slash that admin work and put that time back into patient care or, hey, even just back into your own life? Okay, so before we can fix this problem, we've got to name it. We're going to pinpoint the exact 6 tasks that are creating this massive documentation jam in pretty much every dental practice. And here they are, the big 6. You've got your initial evaluations, treatment planning, writing up those treatment plans, documenting progress with SOAP notes, patient education, and finally, discharge summaries. These are the specific areas where AI can have a massive impact. You master these 6, and you've basically solved 90% of the documentation problem. Let's kick things off with the biggest time thief of them all, the initial evaluation. This is where we see the first incredible transformation, from hours of work down to just a few minutes. I mean, just look at this contrast. It's night and day. The old way, a detailed initial eval can take you, 45 minutes to an hour of typing after the patient has already left. With a structured AI workflow, you can knock that out in just 12 minutes. That is a serious game changer for your daily schedule. So how is that even possible? Well, it's not some super complicated command. It's actually a really simple 3-prompt chain. First, you just feed the AI your raw subjective notes from talking to the patient. Then, you give it the objective stuff, your exam findings, measurements, and finally, you just ask it to pull it all together into a complete assessment and plan. Simple as that. And the key to making this work is something called clinical prompting. Now, don't worry, this isn't coding. It's a super simple formula. You give the AI context, like your messy notes. You give it a role, like you are an experienced dentist. And then you give it a clear action, like organize this into a standard SOAP note. That's it. Context, role, action. Now, this exact same idea works perfectly for treatment planning. But with this, AI isn't just about making things faster. It's also about making them better by baking the latest research right into your plans. So for example, look here. The AI doesn't just suggest, do manual therapy. It gives you the evidence-based reason why, and it even includes a recent citation. This is exactly the kind of stuff insurance reviewers are looking for to approve claims and confirm that what you're doing is medically necessary. Okay, let's bring this into the heart of your day-to-day work, creating patient handouts and, of course, documenting progress on every single visit. Making a custom handout for a patient, which used to be a pain, now becomes a super quick 3-step process. First, the AI helps you select the right exercises. Second, it writes out clear, easy-to-understand instructions. And third, it formats the whole thing into a professional-looking handout, complete with safety tips. The whole thing, under 5 minutes. Come on, we've all done this. You're rushing between patients, and you quickly jot down something like this. It captures the basics of the visit, but let's be honest, it's not even close to being compliant or complete. But watch what happens when you pop those quick notes into the AI. In about 2 minutes, bam, it expands them into a perfectly worded, insurance-compliant SOAP note. It even uses all those key phrases that justify why the patient needs to keep seeing you. This right here is how you get back 8 to 10 minutes per patient easily. All right, let's wrap up the patient journey. We're talking about the end of care. This is where AI really helps you prove the value you've delivered both to your patients and to their insurance companies. Patient education gets way more powerful when you can actually tailor it. With just a simple prompt, you can ask the AI to create a handout on any condition. But here's the cool part. You can tell it to write it at a 6th grade reading level, use simple analogies, and include clear what to do and red flag sections. This makes sure your patients actually get it. And for discharge summaries, it's all about the data. An AI-generated table like this doesn't just say the patient got better. It proves it. It quantifies it. a 50-degree improvement here, a 26-point jump in their functional score there. This is the hard evidence of your impact that you need for those final reports.
So, when you start putting all of these different pieces together, what does this transformation really look like across a typical week in your practice?
Well, the total effect is just incredible. What used to be an entire workday, we're talking 8 hours a week spent just on documentation, is now cut down to about an hour and a half. That's more than 6 hours of your life you get back every single week. So let's quickly recap this new playbook. You focus on just 6 tasks and you solve 90% of your documentation headache. We saw initial evals go from almost an hour down to just 12 minutes. We saw how to create professional handouts in less than 5 minutes and finish progress notes in 2. And, most importantly, it all helps you clearly quantify patient outcomes to prove your value. Look, at the end of the day, you chose this job to be a hands-on clinician, right? To solve problems and help people, not to be a professional typist. The tools to get you back to doing what actually matters are here, right now. So the only real question is, are you ready to start using them?